Okay, hi everybody, welcome to our session on a data-driven journey. My name is Catherine Eyre. I'm the Head of Quality and Standards at Emh Group. We're a social housing organisation that provides housing and care, and we've got around 21,000 properties, mainly based across the East Midlands region. And we support a range of client groups and have around 1,000 of those clients who actually receive personal care and nursing services from us. We have a turnover around 125 million a year and around about 1,100 employees. And our purpose really is to provide housing and life opportunities for people who need our services. I'll ask Leanne to introduce herself in just a moment, but before I do, I just wanted to just briefly set into context how we came to partner with Data4Orchard. So some of you, I'm sure, will be aware of this model here. And it was about 2 years ago, I actually wrote a new equality, diversity and inclusion strategy for EMH. And the aim of that was to improve our practices around EDI and really to create impactful decisions and change in the way EDI issues were raised and handled, and really so that we learned from them. And that was alongside ensuring that we got really robust equality, diversity and inclusion targets, policies, practices, training, the whole shebang really. We actually wanted to make data-driven service delivery decisions that we could actually track back to the strategy, because that was one of the most important things to us, is that seamless golden thread. And we wanted to create that transparency and trust in our services, in our employee offer, in personal development opportunities, and really across the whole range of services and employment offer. Our EDI strategy came from a place where we wanted to plan what we wanted to achieve, and this is obviously where the Deming cycle, plan, do, check, act comes in. So it's about planning what we wanted to achieve, implementing that plan importantly, and understanding the results of our efforts to change them if that was what was needed. We were also about to embark on a massive business transformation project, and as part of that we'd recognised that it all started and stemmed from our data. Our data was essentially making sure that we could bring about the change that we wanted to see, that one version of the truth was just one version of the truth and not many. And also that it was, from an EDI perspective, getting data right was really important because it had the ability to drive so many different outcomes. Our data at that time was partially complete. It was collected in so many different ways at so many different points of contact, both with customers and with staff, by so many different teams across the business who all kind of used it from different but interrelated purposes. And we actually needed to understand all of that and unpick it all. And so this is where I hand over to Sian Basker from Data4Orchard to introduce herself and take you through how we did that and what our data journey was. I'll hand over to Sian.
Thank you, Catherine. So yes, I'm Sian Basker, Co-Chief Executive at Data4Orchard. Data4Orchard is a social enterprise that specialises in helping other organisations to get better with data. So just a quick note to you, if you have any questions along the way, please put them in the Q&A channel. And if you like anyone else's question, please click on it and give it a thumbs up, and that will help us at the end to work out what questions to answer. So yeah, the 5 key tasks. The first task, check out the data, see how good it is. The second task was look more widely at what other measures of equality and diversity are available locally and nationally and how it matches with the data being held. Thirdly, recommend what data EMH should be collecting. Fourth, have a good dig into pay gaps. And finally, and most importantly, engage staff on how to improve with data. I'm waiting to say this. Oh, you've done it ahead of. I wanted to say it.
Oh.
Next slide, please. Oh well. Anyway, our starting point for this were the protected characteristics from the Equality Act. So there are 9 protected characteristics: age, sex, race, disability, religion or belief, sexual orientation, gender reassignment, marriage, and civil partnership. There's also pregnancy and maternity, but we didn't cover that because it's covered elsewhere in employment law. So next slide, please. Thank you. So EMH provided us with 3 anonymized data sets. There were about 18,500 tenant records, just over 1,000 staff records, and 14 board member records. And we explored those data sets in relation to 3 what I would call foundational data quality measures: completeness, consistency, and definition. Next slide, please. So completeness or missing data, it's a bit of a thing of mine, actually. Is the data there? How much is missing? Why is it missing? Is it because you didn't ask the question, or because the person didn't disclose the information? Is it just blank? Because it's really important to know what you don't know and how much of a picture you're actually being given here. So this is what the data said about completeness. You can see we've got the protected characteristics on the left. For each of the 3 data sets, we looked at how complete the data was for the tenants, the staff, and the board. And you can see it looks great for age and sex, 100% in some cases. And then when it comes down to gender reassignment, almost nothing, a little bit patchy here and there, particularly around sexual orientation, disability. So you can see there were a real range in there. Next slide, please, Catherine. Consistency. So consistency was really us looking at how exactly the different data sets matched in terms of the fields, the formats of the data, the categories that were being used. And so on the right-hand side here, just next to the second from left, we've got a column of how we defined the consistency. So for age, fantastic. Date of birth is collected in the same format: day, day, month, month, year. Wonderful. But then in other areas like gender reassignment, race and religion, race and disability, it was really poor. Completely different categories and fields being collected in different places. And then definition, this is really about how well each field was defined and whether it was clear and had an unambiguous meaning. And also in relation to this, we matched definitions used in the general population, so what we can get from the ONS. And it's really important to take all 3 of these quality measures together. Because if you look, for example, at disability, in the case of staff and board, we've got all the data there. It's 100% complete. The only problem is really badly defined, and therefore it's not useful. So just as a sort of summary of the overall quality assessment, next slide, yeah. This is how we took those quality measures and compared it for each of those characteristic areas. So as you can see, absolutely great for age, somewhat middling for a few, really quite poor for disability, race and gender reassignment. So moving on to the challenges of comparing your service users, customers, clients, beneficiaries with the general population. Geography is really important. Catherine said there that EMH mostly works in the East Midlands. When we mapped the tenant data by address, we discovered actually they work in 4 different regions. So, I mean, mostly they're all in England, so we have at least got one single country that they were in. But it does mean actually the available equality and diversity data varies a lot nationally, and it varies by characteristic, it varies by geography, and it also varies by how frequently it's updated and reviewed. So sometimes there's a lag, and sometimes it's quite a big lag. So for characteristics like age, it's pretty good. You can get that on an annual basis. You can see, for example, in the context of where EMH works, Nottingham has got quite a young age profile, whereas Rutland's got quite an older age profile. And for ethnicity, you can get that data at a national level and at a regional level pretty regularly. But if you want to look at a lower level, down to like local authority level or unitary authority level, you have to look back to the last census. Given the time we were doing this, that meant we were looking back at data from 2011. Very excited about the forthcoming new census data, of course. But it does, again, it varies a lot. So, for example, where EMH are working in Leicester, you have 53% of the population that are non-white ethnic groups, whereas somewhere like Derbyshire, it's more like 3%. So it varies a lot. And in terms of available data nationally for sexual orientation or gender reassignment, there really isn't any yet. Again, we await the new data. So can I move on to the next slide? One of the things that was most fun about this project was doing the workshops with staff. So we worked with frontline staff who work with tenants and in different kind of care and support services and in buildings and maintenance. We worked with the HR team who were working internally with staff. And we had some really fantastic discussions about data, because I think it's really important to acknowledge that the definitions of the different protected characteristics and our understanding of them are changing. Our culture is changing. So some of the questions that came up were things like, well, are sex and gender the same thing? It's not immediately obvious to everyone. And then there was a whole, confusion and mixture for a lot of people around ethnicity and race and nationality and culture, etc. Defining disability, there is no one single definition of disability, but there has become a more and more consistent approach to now they've actually got it down to just 2 questions about that. And it's not about defining specific medical needs or physical or mental learning disability, etc. Marriage and civil partnership was another area where there was a lot of debate and discussion because the laws have changed relatively recently, only in the last few years. So it doesn't matter whether you are in a same-sex or a different sex relationship, you can either get married or have a civil partnership. And not everyone was aware of that. And then, of course, there was much debate from staff about whether some things are just too personal and sensitive or new to be asking about, and how they felt about it and how the people they were asking felt about having that data collected. We also discovered that in some areas there was some really important data that the staff wanted and needed in order to be able to adapt and deliver good services, and that those weren't actually covered in the general protected characteristics. One of them being specifically about communication needs, speech, language, reading and writing. That was a real issue, and particularly because there's such a diverse range of people from different nationalities. So the need for translators, for example, was quite a big one. And the other one was around disability and health conditions. And over the years, we at Data Orchard have worked with lots of organisations that work in health or mental health or different kind of disability organisations. And so defining disability itself is a bit of a challenge. We did manage to dig out, if you could just put the next slide on, this set of questions, which come from the DWP's Family Resources Survey. And after some consultation with the staff, this definition of different disabilities and health impairments was felt to be the most useful for frontline staff, enabling them to understand, for example, if someone's got Alzheimer's, or has anxiety, or has learning disabilities or a hearing issue, in order to be able to deliver their services and prepare people prior to visits. So that sort of covers the area around what data to collect. Another major part of the project, which we were delighted to get involved in, was pay gaps. If you are exploring equality, I would say there's almost nothing more important to consider than economic inequality and the unequal distribution of income and the disparities between different groups. I will say it's quite a murky and highly contentious area. It's murky. I mean, I could probably do a whole session on pay gap analysis, but I'm trying to keep it a little bit brief. It's murky because of comparing part-time and full-time, and it doesn't always capture the 0 hours and piecework angle of things. There's a lot of hiding for some companies and sectors behind averages. It's contentious because many of you will be aware, the charity sector is often being called out and pointed out for, the charity CEO's salary. I would say there are some great principled recommendations coming out, but the policy leadership in any sector is pretty low. So you would have to, I would say we probably should just, in terms of any regulation, don't hold your breath. Ultimately, though, pay gaps is about how differently you value the time and labour of different people in your organisation. So I really admire EMH's willingness and openness in wanting to understand this and get better in their organisation. So in fact, they chose to measure the hourly rate between the highest and the lowest and do it as a pay ratio, which was 18:1. Just to put that in context, in the FTSE 100 chief executives pay, it's 145 times, not the lowest, but 140 times the average national salary, which would assume that they were paying their staff an average national salary. So just a couple of points about pay gap analysis. Catherine, could you just slide the next slide on? It's really important to consider the hours worked. So in many of the official gender pay gap things, they're only looking at full-time staff. And what you can see here when you compare the weekly hours of male and female staff is that, as is true of our whole sector, in fact, that women are concentrated more in part-time jobs. So we did find that there is a pay gap gender pay gap at EMH, and everybody knows that because every organisation that employs more than 250 staff have to, hallelujah, publish their gender pay gap by regulation, by law. It's a fascinating little world to dig into. So EMH have been publishing their gender pay gap since 2018. It is 11%. Compared to a national figure of 9%, but also you can compare with peers with peers. So it's actually a little bit lower than other housing sector organisations in their industry, which is 12%. Next slide, please, Catherine. The other thing we looked into was intersectional diversity. So here, this came up in the other workshop earlier this morning, actually, intersectional diversity. So what we've got here is mapping sex and age against income, hourly rate, hourly earnings, and you can see the differences and the gaps between them, between different bands of age groups. We did actually do this analysis for other protected characteristics, but as I mentioned earlier, if you haven't defined your ethnicity data or your disability data, and you haven't got the good enough quality data, then this kind of analysis is going to be meaningless. But this was a year ago and things have changed. So just finally to say, in terms of Data Orchard's role in this, these were our recommendations back in May 2020. I will say it feels like an eternity. This last year, it's like a different time zone. A lot's happened in the last year. I suppose the first thing was our recommendation was to ask the right questions and be consistent. And we provided a recommended questionnaire with consistent and well-defined measures. Secondly, work out the process for collecting. Thirdly, increase knowledge and understanding. So being really clear for all staff, but especially those who are responsible for data collecting, about the purpose for which the data is being collected for every question and the definitions around those. Number 4 was really about this quality thing. Just keep working at the quality. It never goes away. It's not like you do this job and it's done forever. You do this job and it goes on forever. So, and our final recommendation was test it out, pilot the questionnaire. You know, we can do everything. We can have perfectly defined and consistent questions, but actually the big challenge is collecting the data. So on that note, I'm going to hand back to Catherine, who's going to tell us what happened next.
Thank you, Sian. Thanks very much. So yeah, Sian mentioned some really key things for our data at EMH. So I'll just cover how we responded really and what some of the outcomes were. And there were some that were really positive and some not so. And there's also a number of next steps. So I think this is our story, if you like, of how we use the data and wanted to bring about the change. So in terms of things like asking the right questions and aligning them, well, you know, you'd think it'd be fairly straightforward, but as we found out from the workshops that we held, and I've put a few pictures up there of some of our colleagues who joined us, there was such a diverse range of surveys that were being used at the time, and each of those surveys kind of were owned by different parts of the organisation. And it meant that we really needed that one version of the truth survey so that we could really align it across the whole business and make sure that everything was consistent. And the format that Data Orchard prepared for us was absolutely great. It gave us that real key starting point. But also what it did, it could be applied across the plethora of different teams collecting the data and so on. But what we actually had to do, we had to go on a bit of a journey of sharing our reasoning with both our staff and our customers about why we wanted to collect it. So creating that understanding really about, okay, well, why are we asking the questions? Why do we need to? What are we going to use it for? You know, that whole piece really around good data collection and responsibility around owning that data. The next thing that we very quickly realised was that involving colleagues from across the business was absolutely vital for us. We are a very diverse organisation. You know, we've got an active development team that builds properties. We've got housing management teams that deliver services to 18,000 plus households. We've got a care and support business. We've got an in-house gardening service. So it really is a diverse organisation. And so we invited them to share their previous data journeys and the obstacles that they found along the way, really. They actually said it was pretty much impossible, not entirely, but pretty much, to actually compare data sets. And it actually required a few tweaks here and there to try and align data sets, to map one data set to the other and so on. And from the way we asked the questions, to the way we captured them, to the way they were then interpreted, to the way they were presented, consistency for us was absolutely key. And colleagues again told us they needed that one version of the truth, that the data must be reliable. And some of the comments, and I put a handful up there, some of the comments were so similar that message came across loud and clear, and we had to listen to that. And we really wanted to take action that made it very obvious to colleagues that we had listened. The title of this presentation is A Data-Driven Journey, and for EMH, it's kind of been our mantra for about 2 years as we get better and better now at collecting and using the data. And we're modernising the way we work through our transformation journey. And actually, as part of that, using data to give us really clear decision making and using it to drive real business results and outputs is really important to us. So that one version of the truth and getting that clarity and consistency around that is absolutely key. So in terms of us piloting the questionnaire and also creating that process to regularly cleanse and update and monitor it, that was another key piece of work. We didn't actually want to throw the baby out with the bathwater. We've got some really great data already, and some really good completeness around things like sex and age. But we also recognise that data could actually change significantly, especially data around sexuality and marital status. So we did kind of go back to the beginning and look at it, and the actual form that was created by the questionnaire that was created by Data Orchard, we kind of now refer to it fondly as our EMH census. And we needed it to be suitable for all of our client groups, our colleagues and our board members. We didn't want to create another problem by having 3 different questionnaires. So in aligning all the questions and all the possible responses, we developed that census, and alongside it a set of really comprehensive guidance notes in language that was easy to understand but also not patronising. We also found we needed to develop an easy read version for our clients with learning disabilities in our care and support part of the business, because we had to try and get answers from them about their individual characteristics. But obviously with learning disabilities, some of them don't have the same level of understanding. Some people don't have the same ability to read and write. So we had to really think about using pictorial images and things like that. We tried to develop the approach so that it was, it made people feel comfortable in sharing their information with us. And that they felt they could trust us with that information as well. And trust is really, really key when you're asking people very personal questions. And so where we could give the option of prefer not to answer in the census, we included it. We developed a whole raft of new workflows in our HR and customer systems to make sure that we could hold the data in the same format, and also to make sure that it was easily accessible and consistent too. And that means now we can actually look at that data and compare it much more easily. And what we also did as part of it was look at how we were reporting on it, and really try and develop new targets for the data and some positive actions around that. And we're working with our board on redefining some of those, but a little bit further in the presentation I've got a slide which shows you some of the work that we're planning to do and also some of the work that we have already done. So we're now looking more closely at the data gaps. We're working with our neighbourhoods team to improve the completeness of that data. And one thing that we did find is that we did a bit of an analysis of where we measured the number of new sign-ups. So these are people, these are tenants who are waiting to be given their keys. It's almost a captive audience, if you like. And what we found was that actually our data completeness was not really great when we were signing people up. And that meant that with a 10% turnover in stock, if we could capture those 2,000 new relets each year, then over a very short period of time, we'd have much greater completeness and accuracy in our data. And what we actually found was that we needed to drive that process. So we needed to get the staff who were signing new tenants up into good practices in collecting the data. And as again, I'll show you in a little while, that did actually pay dividends for us. It was a quick win. The data gaps weren't any longer in the new tenancies, they're now actually in the older tenancies, the tenancies that some of them are as old as 30 or 40 years. So that's where we could immediately see there was a difference. It was kind of early 2020 really by this point. So we've been working with Data Orchard's reports and information they provided for sort of 6 months. And we got by this time nearly 20,000 tenancies with household numbers of between 1 person and 9 people. And really, we found that we were hitting some quite significant issues, really. So how on earth did we go about sending the survey to all 20,000 households? Did we segment it? Did we pilot it, something that was suggested by Data Orchard? Did we look at just totally bombarding 20,000 tenancies with anywhere from 1 person in the household to 9 people in the household? But working in 40 local authority areas, well, just over 40 local authority areas, it just didn't seem right. We didn't actually know whether the questionnaire at this point was going to work. So we did go for the pilot. And what we actually decided was that we'd go back to the data and look at the concentration of gaps that we'd got. And where it told us we'd got the majority of activity happening in those areas, in those local authority areas. So, for example, we looked at the numbers of repairs for those areas. We looked at the number of housing services that would be being delivered. We looked at the number of complaints. We looked at the number of incoming calls. And we overlaid all that data on top of each other to see what it was telling us. And what it told us that there was 3 areas, 3 local authority areas, that really stood out for us. And they were Northampton, North West Leicestershire and Leicester City. All large stock areas for EMH and all in the East Midlands region. So we thought, okay, that's fine. We'll start with Northampton. And our approach was to email everybody that we had with an email address in that Northampton region. We provided a link, a SurveyMonkey link, and that had the actual survey on it. And we also provided them the notes pages that we'd produced. And you've guessed it, our return rate was pretty rubbish. It was about 7%. But not to be disheartened, we carried on and looked at North West Leicestershire next. Now, North West Leicestershire is an area with a much younger demographic. It's got a lot of family accommodation, but it is also one of the most deprived areas in the East Midlands. So in terms of them having access to the internet and so on, it tends to be on a mobile device. Not all of the homes, particularly for the demographic and the client group we're looking at, so those in social housing, not all of those households would have had access to a PC or a tablet or a laptop to be able to connect to the internet that way. But we still did have a good amount of email addresses, so we sent it by email again. And I'd like to say that we had a great response rate, but it was about the same, about another 7 or 8%. So in terms of that, it was pretty poor. What we then did really was ploughed on and looked at Leicester City. Now, Leicester City is, again, a totally different demographic. Very large BME population, about 53%, 52-53%. And what we very quickly noticed that actually we could not just email this out to a demographic like that. We needed to engage with our teams in the sheltered housing schemes, our colleagues who had translation abilities, and we took a very different approach with that and made it a much more personal experience. And lo and behold, what happened was the rate increased to 12%. So we're still struggling with that. And what we've learned from that is that really it's not easy when you've got such a diverse client group to really have a one-size-fits-all approach. And even where you do tailor it so that you could address those translation issues and make sure that you had got a different way of delivering and getting those questions answered, it still doesn't always work. You know, there's still going to be gaps. And I think where we did go wrong as well was we perhaps didn't enlist enough help from our staff on the ground. You know, we kind of tried to do it in a more digital realm, a more digital era, which was what we were trying to move to as part of our transformation programme. But actually, you know, it would have probably been far more better had we have been able to have gone out mass door knocking. Not something we could have done at the time. When we started to do this, we'd just gone into lockdown. So we couldn't send people out door knocking. We could only, in the social housing sector, we were only at that time allowed to actually deliver services that were absolutely essential. So it was essential repairs, essential relets, so perhaps somebody fleeing domestic violence, for example. So it was really setting the scene that actually we got barriers at the time that we were doing it, but understanding those barriers and looking at different ways to overcome them formed a really key part of our learning processes. So where are we now then in terms of our data? Well, you'll see from this slide, the previous figures from when we provided the information to Data Orchard are the sort of middle three columns there. And you can see that we have made some fantastic gains, some real headway in some of the areas. So you can immediately see, for example, that for race, we went from having 65% of tenant data to actually nearly 97%. And that's really positive for us, particularly when we're looking to offer services in different ways. A few of the customer fields show a very small decline, so age, sex and marriage, for example. But some of that is due to more data cleansing that we need to do. So we have a number of agencies that also support us and look after our stock for us. And as part of that, they're included as a tenant, but they're not a tenant. They are actually non-person data that needs cleansing out further. What we also see is that when we think and bear in mind this project around is not just about our data, but in terms of the wider EDI strategy, we've done a lot of other things that actually help to drive that data completeness and to build trust. And things like carrying out the census in Leicester City helped us definitely, without a doubt, with just over sort of 1,500 clients and properties in that area. That was always going to help. But also the 1,600 new tenancy sign-ups we had last year also helped because we collected data at the first point of contact. Things like gender reassignment still very low, but the percentage actually represents a very small number of people answering it. And if I'm honest, it's still a great challenge for us to get people to answer that question. People still feel uncomfortable sharing their identity. And that's not just something in social housing, that's kind of across the board really in lots and lots of different organisations. We still feel that in terms of disability, you can see we've gone from nearly 28% to just over 34% for our tenants. We feel this is still massively understated. You know, we know from the number of support calls that we get to the number of requests that we get to prioritise repairs, that actually disability amongst our customers must be much higher than that 34%. One thing I would say is that reacting to the data and changing the way you deliver a service off the back of it does pay dividends. So what we're tending to find now is that as we get more data, it gives us the momentum to change service delivery. And by changing service delivery, you actually build trust in people because they see that I've given EMH that data about me, and actually I've seen a change as a result of that. And that brings about a real positive drive. And it's word of mouth. Tenants talk to other tenants. They will say, well, I told them I've got this disability and they did this for me. And so that actually builds momentum and it builds trust. And just changing the way our operatives worked in a household where somebody was disabled or where they've got young children in the house, you know, it actually helped them to trust in what they've given us. So taking the time to actually understand the data is really, really important. But our EDI journey does continue. As you can see, we've got lots of things planned. I won't go through all of those, but we are looking at things like blind shortlisting. We're looking at the way we hold the data in terms of a data warehouse. We're partnering with other organisations on sending out clear EDI messages and so on, and looking at the way that we can work with staff groups to embed diversity and bring about real change. And we're also mapping our journey against a race code so that we can also identify the big ticket issues and what matters to people. And this is all about, you know, making sure that we're a good partner and that we're clear on our journey, really. I think in terms of what's changed around the EDI TMH in the last year or so, well, again, I won't go through the whole slide there because there's a lot, but it's all sorts of things. So greater openness with the data, and Sian spoke about the work we've done around both our ethnicity pay gap and our gender pay gap reporting. We've also undertaken a big piece around cultural values, and that is about really understanding what our staff feel is important to them so that they can really truly bring their whole selves to work. And we're doing a big piece around that using the Barrett values model. We've done a lot around training and mentoring, so we've introduced mandatory EDI training and also mandatory unconscious bias training for recruiting managers, and it's optional for other staff, so they can do that if they want to. We've done some mentoring work with Housing Diversity Network, and more recently, again working with Data Orchard, we've been looking at a project around helping HR to understand their data, and they've had some training in data fluency. We've introduced things like the Rooney Rule, and for those of you that aren't aware of that, just Google it. It's really insightful, and by all means ask in the Q&A if you'd like some more information about that. Leadership and sector leadership is really important. With EDI data, if you can see it happening at the top, it cascades, it creates a waterfall effect. So having a champion on our governing body, having those local authority partnerships, making sure that our CEO is blogging and vlogging regularly to both staff and the exterior networks that we have is really important. And creating a culture around equality, diversity and inclusion is also important. So obviously off the back of Black Lives Matter, we partnered with a couple of our local authority partners to share good practice and exchange ideas. And we've also gone public with that and put an expression of our unhappiness, our disgust, if you like, with what happened around that whole culture and all around the Black Lives Matter incident. And really a raising awareness of our staff and their individual struggles. And we had a couple of our staff members really share their personal experience about coming out as gay with other colleagues through our staff magazine. And it's things like that that bring trust, it brings clarity and it brings understanding. And when people can relate back to an individual's true life story, that's the big ticket, that's the thing that's important. And so that concludes the presentation. I'm going to stop sharing my screen. Our contact details for both Sian and myself are there on the screen, but I'm going to stop sharing now. And if there are any questions, I think we do just have a few minutes to do those.
Hi, yes, we've got one question in the Q&A, but I was going to say also that Data Orchard have got a booth in the expo area, so you can also come and chat to us there, as well as email either Catherine or myself. So Catherine, we have a question from James Tullock, who says, as a grant maker, when asking grant applications for DEI data, some people say DEI, we said EDI, but anyway, same thing. I think the three words are equality, diversity and inclusion. He says, how best to strike balance between using data for monitoring only rather than decision making? How best to reassure people providing the data?
Yeah, it's a fine line, because and actually when you think about things like data protection law, GDPR. Making sure that you're really transparent and having those privacy notices in place is one issue. But it's that transparency, telling people what you're going to use it for and giving them the real life examples we found works best. And when we developed our data, our questionnaire and the notes to go with it, we gave those real life examples. So, for example, we only, when we're applying for grants and funding and things like that, we use anonymised data sets. So no individual can be identified from the data, but actually it shows that we understand our tenant demographic, and that means that they can actually truly focus in on what's important for that particular demographic. So I can't stress strongly enough, if people want to trust you with the data, the only way that you will achieve that is by true transparency over how you're going to use it. We don't sell our data, you know, we use it internally, we use it to partner with organisations, and from the very outset, so from the point where somebody applies to us for either employment or rehousing, at that point we're actually saying to them, this is how we're going to use your data, this is what we use it for, and that is the only purpose. Oops, the hand's on mute.
Thank you everybody for joining us for this session. I'm sorry we've run over a little bit, but we've really appreciated your interest. And as I say, if you have any more questions or you want to follow up, we're just writing this up as a blog post, which should be available through Data Orchard, and we'll be doing a second part of that as well. So yes, thank you for your interest, and best of luck. Do get in touch if you have any questions or follow up.
Yes,
thanks,
please
Catherine,
do. Thank you, everybody.
Lovely to work with you again. Bye.
Thank you, Sian. Bye.